Bloom IVF introduced assisted laser hatching for the first time in this country at Leelavati Hospital in 1998. And since then, we've never looked back. All our 5 units today have the laser. And laser has become a really important tool. You know, this laser is actually such a fine laser. You know, it's even more fine than the ophthalmic laser which they used to cut the cornea. This laser goes and cuts the cover of the embryo, which is known as the zona. Now we are using a technique called zona thinning in the laboratory. So there are a lot of patients where it is really beneficial. You know, patients who've had previous IVF ICSI failures, patients who are older than 38 years of age, patients who've had frozen thaw embryos, then patients who've had tuberculosis in the past, patients who have a thick hardened zona. All these patients are definitely benefited from zona thinning. It is the same procedure of an IVF or ICSI where the embryo is created. The only extra step is that under the microscope, this embryo is kept and the zona is thinned. Typically, we thin between 1/3 to 1/4 of the zona, the lengthwise, and breadth it's thinned to half or maybe even 2/3 of its breadth. So this is what helps us in getting pregnancy rates. Our first babies were born in 99 and in fact they were named Nandita and Rishikesh. So this is a technology which has given a lot of joy to many couples and we are very, very happy with it and using it a lot.